So, now that I've told you about the types of treatments, I'll say what mine were. So my treatments that I received were chemotherapy and radiation. So they started with both, actually. So they needed to do radiation because they needed to reduce the mass that was on my chest, so that one, I could breathe, and two, they could get rid of as many cells as they could really fast. So I had treatment, actually I'm not sure how long I had it for. I think it was probably for a couple of weeks or a couple of days. I was not really aware of that. At that point, I was kind of unconscious most of the time. So that's more of a story that my parents would know versus that I would know. So I had the radiation, and then they gave me chemo. So I had chemo for about 2.5 years, I believe it was. Yeah, about 2.5 years. So at first they have a really, really heavy regimen. So it's like you have chemo multiple times a week. And at first I was in the hospital for a long time, and usually you start off in the hospital for a long time, for like a couple months, and then you slowly get to be able to go home and then go back to the hospital for more treatment in the week. So just back and forth a lot from the hospital. So after the initial like multiple times a week, and then they kind of reduced it to maybe 2 times a week, and then they kind of reduced it to once a week, and then it was once a week for a while, and then they kind of started to reduce it more. Eventually it was only once a month that I had to go, so that was great. I received a lot of different types of chemo drugs, like a lot. A few of them were vincristine, and actually that's the only one I can remember at the moment, but I swear I had a lot, so many that I can't even think of them. Yeah, so so chemotherapy drugs, the reason they affect fertility is because if you have the really toxic ones, which are called alkylating agents, they kind of change your DNA a little bit, so it makes it a little bit more difficult to produce healthy eggs or sperm, pretty much, or it makes it difficult to conceive, so it kind of makes you infertile. So that's why chemotherapy affects fertility, and then radiation can affect fertility if you get it on the pelvis area, the lower back, or the full body, because although radiation is aimed very closely to wherever it is that the tumor or cells are that they're trying to kill, it also sometimes kills other cells that are good. So because of the areas, the pelvis, the lower back, and the full body, it's reaching those reproductive areas. So for a woman, the uterus, the ovaries, so it's hitting those, it can sometimes hit those areas and damage them, which can make someone infertile or cause it, or make it to be a lot harder to conceive, or even put them more at risk during pregnancies. And then for males, it can harm their testicles and stuff like that, pretty much just any reproductive organ. And then surgery, the reason that can harm it, like I said, surgery isn't really used for leukemia, but it is used for other cancers. If you get a hysterectomy or surgery on the uterus, then it's going to be really hard or impossible to conceive. Same with the ovaries. If you have ovarian cancer, for men or boys, in this case, since we're talking about childhood, testicular cancer, if they have that, then they may have to have their testicles removed, and then they can't reproduce. But also, if you have surgery on areas in your brain, so I believe it's the hippocampus, the pituitary gland, we're just gonna go with those two because, yeah. Those are where some of the sex hormones come out or are produced, held, that kind of stuff. So if those get messed up, sometimes it can cause infertility. The main things that chemotherapy cause, sorry, I'm going back to chemotherapy, but the main things that those cause that will end up leading to infertility, so it's kind of like indirectly affecting it. It causes hypogonadism for males. So pretty much it makes it so that that there's a lower sperm count. So when there's a lower sperm count, it usually means less chance of being able to impregnate somebody. And then for women, it can cause early menopause. So it can cause it before the age of 40 or by the age of 40, which is earlier than a lot of people experience it. Or it can even cause it acute ovarian failure. So pretty much the ovaries just are not going to properly produce eggs and stuff right away. So through my research that I've done for this project, I have found that males tend to be more at risk for infertility than females do, according to a study, which I will put the link to the study or the journal below in the description. It says that for females, it's about 24.3% impaired gonadal function, which is just like your ovaries, your uterus, or actually no, it would be ovaries for women and then your testes for men. They are just not properly working, which often, like I said, leads to infertility. And then so 24.3% for females and then 55.6% for male survivors. So males do have a much higher chance for infertility than females do, which really sucks for men, but makes me feel a whole lot better as a woman. Another thing I want to mention is men and women, or girls and boys if it's children, it tends to differ for treatment. So for leukemia specifically and childhood, boys tend to get chemotherapy or the treatment for 6 months longer than females because it's found to be way more effective and less of a chance of it reoccurring later in life. So they do 6 extra months. Like I already said, they have a greater risk for infertility. And the reason for that is because they tend to have a higher dosage in their drugs, but also because of the extra 6 months that they have to go for. And then for females, luckily, treatment isn't as hard on them. Like I said before,